Good morning, everyone. Gareth Presch, founder and CEO of the World Health Innovation Summit. I am delighted to welcome you to our Fireside chat. As part of WHIS 2024 online, I'm talking to Alison from the Commonwealth, and we're going to get stuck into climate and health and the intersections. Alison, you are very welcome. And I know you're probably jet lagged from all the travel and COP, but I'm super excited that you could join us this morning. And please, an introduction.
Great, thank you, and thank you for inviting me, Gareth. That's most kind of you. Good morning, good afternoon, good evening, people that are online wherever you are. I'm Alison, and I head up our sort of public health, climate and disaster resilience space for the Commonwealth. And for those people that don't know about the Commonwealth, this is the most special of families. It's 56 member states, and it's everybody from India right down to Kiribati. So we have G7, G20, G77, and we have 33 SIDS within our dear family. And the beauty of the Commonwealth is that we have 2.7 billion people, and 60% of those people are under 30. Apparently, I'm no longer under 30, my son tells me. However, let's think about what we are doing collectively for today and tomorrow's generation.
Thanks a million. And Alison, I mean, you've just come back from COP. Before we get into the questions, I mean, what was your sentiment? I mean, there seemed to be a lot of disappointment there, but at the same time, 300 billion is a stepping stone. We know we're below the trillion target per se. I think it's 1.5. But did you get a sense of optimism still? Are we and is there an opportunity, I suppose, firstly, health and climate? I mean, health is under so much pressure.
Yeah, no, you're absolutely right, Gareth. And I think this is my third or fourth COP that I've been to. I was very involved when I was at the UK government on COP26, and in fact was the person to sort of say, let's think about health in these conversations. So I'm very much about how we can step outside our silos and have those conversations. And hence, in COP26 in Glasgow, we had the first health pavilion, because we cannot do anything. Health has to be that DNA throughout everything that we do, whether it be energy transitions, whether it be sustainable transport, whether it be around food security, etc. We have to think about health. Back to question on Baku. So it was really interesting being in Baku, obviously being hosted by the Azerbaijani government. I think the sort of views on the overall outcome are disappointment, but not despair. So the money is starting to have that conversation, but I would say we need to go further than a conversation and the check is in the post. We actually need the money now to many of our vulnerable Commonwealth countries who, are continuing on a day-to-day basis of having the impacts of a changing climate upon their populations. In fact, we only saw last month in Valencia, where sadly 200 plus people died from the flooding. Again, so it's not climate change is coming, climate change is happening right now. And so people need action right now. People need the money right now to make sure it goes to those people that are suffering the most. And many of those are in the Commonwealth.
Yeah, and we're seeing it right across the world. I mean, look at last year. You had Pakistan. Remember the terrible floods in Pakistan? There was millions of people displaced. You see in sub-Saharan Africa, the malnutrition area. So we do need to address these issues, and that's I completely convinced, like yourself, health has to be at the forefront of these discussions in terms of climate action. And then if money is flowing into these Green Deal projects, we need to look at the opportunities for health and well-being to also come in terms of the value proposition.
Absolutely. And health has to be part of that energy transition, because if we don't have a healthy community, then you've got no wealth in a population, and with no wealth you've got no GDP. So we absolutely have to have health as that DNA, that golden thread through everything that we do, whether it's talking about your your health workers, your wider workers, whether it's about energy transitions, the linkages to sustainable transport, the linkages just throughout everything that we do.
Yeah, and sometimes we don't realize the respiratory illnesses, for example. Okay, we don't even factor that in. That costs the NHS $1 billion a year.
Yeah,
There's
and
a
then yeah, absolutely. And if we look at, for example, what's happening in Delhi at the moment and the air pollution on a day-to-day basis there, the impact on people's respiratory health, the impact on cancers, etc., from people just going about their day-to-day work. So the air pollution in Delhi, I'm led to believe, has improved recently. However, people are still being impacted. So how do we think of that greener, cleaner and healthier transition? It has to be part and parcel of this.
Well, that's what we're going to get into today. We're going to really focus on that climate and health. So if anyone's tuned in around the world, has any sort of questions, do pop it in the chat. Let us know where you're from as well. And I'm going to just start with a simple one, Alison. Like, what are the most significant health risks associated with climate change, and how do they disproportionately affect vulnerable populations? I mean, that's right up the alley of the Commonwealth.
Absolutely. How long have we got, Gareth? Because there is so many impacts on a day-to-day basis. So if we just take, for example, the increased flooding waters, well, that brings, of course, impact on the agriculture of a country, especially for our countries in Africa, for example. And then if you've not got your seeds have been washed away with the flooding, then, of course, or you've got severe flooding in your fields, then of course that's going to impact your food security. Then you've got the malnutrition and you've got wider issues from a health perspective. So we're all interlinked. So if we think about the trade side of things, again, many countries are looking at trade. There's something about the sustainable supply chain of trade, and again the thoughts around sugar and the sugar in part of trade, and how do we do that to make sure that we've got healthy communities. The increase in heat, we've got heat stress going on, dehydration. For example, in countries like Malawi that had Cyclone Freddy nearly 3 years ago in March next year, we're going from extreme sort of flooding and cyclones right through to desertification. So, you've literally got those extremes happening in countries right now. So again, the impact of increasing waters leads to increasing mosquitoes, and then you've got increasing infectious diseases like malaria and dengue fever. We've seen in the Caribbean, again, just in June of this year, we had the first Category 5 hurricane hitting Grenada, Barbados, St. Vincent and the Grenadines, all again Commonwealth countries. So we had 3,000 people displaced from one of the islands off the coast of Grenada, and they have it's now thinking about how do they repair, but people have lost their livelihoods, people have lost their houses, and again, without a healthy hospital, because the hospital's roof's blown in, then you've got no sort of ability to help that population. And then you've got the other issues, Gareth, around if we continue to decrease our biodiversity, if we continue as humans to live closer to nature, you're going to have increasing zoonotic diseases. Now, we saw that again with the sort of the COVID pandemic that we all suffered globally. Infectious diseases have no borders, so how do we make sure that if we're continuing to live with nature, that we're not again becoming close to them because we're chopping down their livelihood, their homes, etc. So we need to think about health in all of this, in nature and biodiversity. We need to think about it in the climate environment space. We need to think about it in the trade space. We need to think it not just in health itself.
Yeah, absolutely. I mean, there's so many points that you've made there, and I've experienced it myself, unfortunately, this year. Like, I was in Helsinki and I came home and my house was flooded. So it does start to have an impact, and I think we have to get serious about it. And that happened in May earlier this year. I came back, I couldn't believe it. So there are serious problems. And also last year, I was fortunate enough. I was in New York at UNGA, and I went to Hoboken, and the mayor was showing us the impact from flooding as well, and diesel and chemical floods, and the impact on people's health and well-being. So, the reality is these things are happening more often, and we have to start to
and the
prepare.
intensity is getting greater, as we've seen in the Caribbean. And not only people's physical health, because again, we can't see that in isolation, but let's think about the mental health. So if you are a family in the Caribbean and Grenada, you've just seen your whole livelihood blown away. That mental health impact of future of generations. And if you're a child that's just seen your school washed away or the roof blown off because of the cyclones or the hurricanes, then you're going to be out of education for the next X amount of years. So what impact does that have on a future workforce when you've got a generation of children who have got severe mental health issues because of the changing climate on their well-being? So, if you've lost family members, etc., the impact on people's mental health, and I know that's something that we're looking at in Bangladesh, again, from the sort of flooding, the impact on children's mental health because of a changing climate.
And I suppose that leads me nicely into the next question, like how can healthcare systems better prepare for the health impacts of climate change, such as the extreme weather events we're talking about, rising temperatures and air pollution. I think air pollution is a huge issue that we don't really get to address at the moment.
Yeah, so I know the WHO have been doing quite a lot on the air pollution side, healthy cities, etc. There's a really good example in Kerala in India where they're making a more sustainable, more healthy city. How can healthcare systems? So I would think we have to think about resilient healthcare systems. We have to think about how we make our health. And I don't just talk about the physical buildings of hospitals. Let's think about communities. Let's think about how health should be more preventative and closer to home, as opposed to waiting till people are in hospital. I am encouraged by the use of sort of digital innovations and AI. It's not the answer for everything, but I think that utilising that can help us get out of some of these sticky situations. So, for example, in Jamaica, Chris Tufton, who's the health minister over there, has done a sustainable hospital provision so that it's actually made from, it's going to be more resilient to potential hurricanes. It's a smart hospital. It's got solar powers, etc. Solar-powered opportunities for keeping the electricity and the energy going in the hospital itself. So again, there's lots of great examples, especially around the Commonwealth. And I feel like I'm a shiny magpie and I want to bring all those special sort of innovative works and examples that have happened, not only top down, but bottom up, because absolutely it's people, it's our communities, it's our brothers and sisters, it's our mothers and fathers and our children that have many of the solutions to what works best in their community. So bringing that all together, then it might be that, okay, this has happened in the Caribbean. How can we transfer that to working in the Maldives or in the Pacific Islands? What can they do that can just tweak it around the edges to make sure that it works for them and their community? One size doesn't fit all, but I'm very much still with pride. We don't have time to reinvent the wheel. Climate change is very much impacting us on a day-to-day basis. So let's deal with pride and take what has been happening and been ingenious sort of innovations around the world and bring it down to your local level in your community to make a difference.
Well, I mean, I've come across some examples of that with technology companies and using artificial intelligence, for example, on the ward, for example, where if you look at weather fronts, you're able to identify pollen counts and they'll know then that they'll have a certain number of conditions and they're able then to assign nurses to make sure that they're on when those pollen counts are high, so for respiratory reasons. So the technology is certainly there. The adoption is needed. We talked about this earlier about being able to put the value proposition across to all the stakeholders, which is critical to get the adoption. Just if we look at the next step in terms of in what ways does climate change exacerbate health inequalities? Now, particularly in the Commonwealth, because quite a lot of those countries are dealing with health inequalities. What can we do to address that?
Yeah, absolutely, Gareth. And of course, it's women and children that are mostly impacted by the changing climate. For example, in many of our African countries, women and children are at the forefront because they're the ones that are doing the caring, or they're the ones that are working in agriculture. They're the ones that are at home when the roofs have been blown away by the cyclones or the hurricanes or the floodings coming. So what can we do around the health inequalities? I think there's, again, where do I start? There's so much potential in terms of what we do, and what we need is that connection between governments and not just health ministers. Health ministers can't do this on their own. This has to be a whole systems approach. We need the private sector to be part and parcel of this, and we need local communities and solutions to help guide and sort of come together, bridge that sort of health inequalities as already existing. Now, I guess because women and children are often the people, as I said, that are most impacted, but they also have the solutions. If you look at children today, they are often first and foremost with technology. I sometimes have my own son grabbing my phone from me and saying, "No, Mum, you do it like this." Children are growing up with technology as part and parcel of their DNA. So we need to help encourage Indigenous peoples, people from communities, and make sure that we're listening. We're listening to them, not just ticking the box that they were at an event, but actually embracing that wisdom that's potentially been passed down through generations and has been adapted for today's climate.
Yeah, I couldn't agree more with you. I mean, been speaking to my daughter. She's 8 years of age. She was speaking to me. She's very aware of what's happening in the world. And interestingly, she was asking me today, would this be on YouTube Shorts? Because of the technology that she used. And she was asking me, how could she help me to promote it across YouTube Shorts? So I do believe there's, certainly youth have a way with technology, far better than I am. But I also think you're so right with co-creation, and the solutions are actually in the community, and even locally here when we worked, we embedded what we were doing in Cumbria, and we worked with Age UK, and they were able to identify loneliness, and we were able to co-create a solution with the local GP practice. Now that can be applied anywhere in the world, and you're absolutely right. I think what's crucial as well is this silo thinking. We need to be able to work across sectors and build bridges into the business community and the financial sector, because it's all intertwined,
And I think we're all, and I think we're all connected. We can't do this in isolation. It's hoots. We need to have action. We can't talk about it. We just need to crack on and do it. And I know that sounds easier to say that than actually in reality, but we've got no other choice now. So those countries that have contributed the least to the changing climate are suffering the most. Definitely. And so how do we make sure it's a whole systems approach, and we're not just seeing health over there, and we're not just seeing this over there, and energy over there, and environment over here. We need to be much more holistic in what we do, and have it. And the beauty of some of our member states of the Commonwealth, because of the size of them, I can sit down with the cabinet, the whole cabinet of one of the Caribbean countries, and say, okay, let's look at this strategically. Let's bring in, let's have those conversations. Let's make ourselves uncomfortable and push it and step outside our silos and have those tricky conversations. Because if we don't do it now, then when? Yeah. We've got no other option.
And it's such a great opportunity. I want to ask you about the health sector in particular, because the health sector is a massive contributor to carbon. And so, what is the role? I mean, I think overall health sector is something like 6% globally of carbon emissions. How can health organizations lead? I mean, I know NHS are doing a lot of work around green. How can they lead by becoming environmentally sustainable?
So I think, again, there's not one single area, if we need to even think about the healthy diet side, and if there's that, if you go into any hospitals or the provision of any meals, not just in the UK but in other countries, and if they've got high levels of red meat, for example, in the diets that's provision, well, again, where's been the sort of the food supply and the sustainability of the provision of that red meat? However, that's a really difficult conversation if you're in a country that has very little to eat and has got food insecurity. So, there's a balance for everything. And I, again, don't have all the answers, but the answers are definitely out there. We just need to collate them and bring the people together. Back to the sort of the healthcare side, and the sort of let's bring health closer to home. The health workers are able to do much more in a digital point of view. Some great work going on in Tanzania around this. And I think there's something as well that the drug companies, so many of the pharma companies, again, are trying to make their supply chains much more sustainable and environmentally friendly, and reducing the amount of carbon that's required into many of the production of their drugs and their pharmaceuticals. I know that UNITAD, who are part of the WHO, and the team there are doing a lot of work around making sure that diagnostics, logistics, etc., are much more reduced in their sort of carbon footprint. So there's great examples out there.
Mm-hmm.
Let's just deal it with pride and adapt it to your own space.
Don't be afraid to copy and paste.
Absolutely.
I wanted to come on to, you mentioned resilience, and that's really important when you look at communities. But how do we integrate climate resilience into public health planning and policies to better protect communities from the health impacts of climate change? I mean, this is what a lot of people are going through at the moment. I know myself, I've gone through it in the past, and we've had it in the UK, and you have it on a regular basis in the Commonwealth. So I'm sure you have a lot of examples to share around how do we build that resilience.
So again, let's start with people, because with let's put my mum, your dad, your children at the center of this, and make the systems work for us all. If you had a blank canvas and you were now designing a community or a healthcare system, you wouldn't design it how it is now. You would put the person and the outcome. It has to be about improving people's health at the center of that, and then working out. So let's think about how we make health systems more sustainable, how we make communities, what we do in public health. So, for example, we know that trees help reduce heat. So if you've got extreme heat and you've got no streets with trees on them, that's also there to help with your carbon, we're chopping down the trees in the street. Well, then, of course, it's going to become hotter in those streets. And then, of course, you're going to, some of this isn't rocket science. Some of it is, but some of this is around how we make those connections and get out of thinking in our silos.
Yeah. And that was my next question. I was going to ask you, do you have any sort of examples, successful interventions where climate action has directly contributed to improving public health? I suppose, when we will see more of that as we adopt new technologies, zero emission buses, for example, will reduce cancers within cities. These are very much at the forefront of public health. And of course, at the moment, we have a public health crisis because we don't have enough staff. We won't have enough staff because we're projected to be short between 10 and 18 million by 2030. So, we really need to try and merge this green agenda, climate change, with public health intervention. So do you have any more examples, Alison, that, from the Commonwealth perspective?
Yeah, so there are lots of examples. So I know in Dominica, again, in the Caribbean, who suffered horrendously from some of the hurricanes from Maria and Irma and others in the past. And they've done a lot about becoming one of the first sustainable healthcare systems, and some of the first zero carbon communities So again, there's lots of examples there. I talked about Kerala in India previously, again, who have made one of the most sustainable cities, that urban planning side of things, to make sure that, you know, people are walking more, people are not using transport so much, everything's within, you know, so many minutes. If you're walking more, then you're more likely to become doing physical activity, and then obviously you're absolutely helping with some of the non-communicable diseases. So there's, I know in Samoa and Tonga, if we head right round to the Pacific, there's a lot of work going on there. We had our Commonwealth Heads of Government in Samoa in October. This was the first sort of international event held by Pacific Community, and lots of great examples from Samoa about what they're doing and trying to making those more public health friendly communities, so that communities are becoming much healthier and less dependent on public transport, less dependent on buildings, etc., that don't have the provision for maintaining healthy living, and less dependent on others, again, that increase the carbon.
Yeah.
And we need to think about and just the other thing is that we often talk about land, and we forget about the importance of the ocean. So again, if you are a community, we know, for example, in Tuvalu are saying we might not be at COP30 because of some of the rising waters. How do we think about that? Fishermen and the sustainable, if fish is his only diet and his only ability to get to some money, then how do we think about the ocean and the healthiness of the ocean? We only have one ocean, and it's very much keeping us alive. So we've been using nature-based solutions. In Fiji, they were able to plant mangroves to help reduce the increase of the water, sea levels rising. So again, and I come back to the fact that we can't look at this side in isolation. We need to think on a more whole systems approach.
Well, you know, we could have a whole session on just oceans, you know, because I think it's very important for people to understand and just be practical here. Listen, if you're dumping plastic into the ocean on a daily basis, just go up and dump plastic into your bath on a daily basis. And eventually that will disrupt the currents. Do you know what I mean? So it's not even about, you know, so we've got to be very honest and open, transparent with people. People need to just realize if you take an action, it has a consequence.
Yeah, cause and effect, and that's a simple thing that you tell your children from day one. Touch that, it's hot. Do that. So, you know, every cause has an impact. Now, we're not going to get it all right because we can't. But what we can do is try and readdress the balance.
Exactly. And if you look at the pollution in our oceans from plastics, microplastics, we're now seeing the effects of that. Even you talked about, the supply chain within medicines and drugs. I mean, quite a lot of that ends up in the toilet, unfortunately, which then has a knock-on effect when it leaks into our rivers and into our water supply chain. So, you know, we need to be very conscious. There's contaminants of emerging disease, that are going to cause problems long-term. Fertility, for example. I mean, that's another conversation.
And the AMR, of course, as well. So if you have a whole load of and look, I sound like I'm being a doomster and it's all, dark and doom, but I have hope. We have to have hope. And I have hope that generation, that 60% of the Commonwealth who are under 30, their innovative ideas, their uses of today's technologies and AI. And if we are able to encourage, empower, support them critically with finance from the private sector, then you might start to see almost 1,000 flowers bloom, because with every positive action that's going on, then cumulatively we should start to change the balance and readdress the difficulties that we've currently got ourselves into.
I'm very optimistic, but I think firstly you have to address the fact that there is the problem. And I think in order to address it, you have to be clear with people and say, yes, we do have a problem here. That's the only way we can actually get over that hump. I think that's what we have to be, very transparent and very honest with people. We will have
difficult conversations.
Yes, difficult conversations. Our next panel discussion, actually, after this session, our fireside chat, is around AMR and infectious diseases. So we'll go into that. But I wanted to also talk about, these are emerging climate-related health threats. Do you foresee, how can governments and communities respond proactively? This is what we talked about. We know if you do this, you're going to get that. So we know what we're doing. We know the trajectory. We know that the climate is changing. We know that we're having heat waves. How do we proactively respond? Like you said, flooding, it's happening. So how can we mitigate that?
So the first thing I think, and I have had these conversations with many of our Commonwealth governments, is to bring your government ministers together to have those conversations as a whole and that strategic approach. There's no point in environment ministers doing one thing and climate ministers doing other and health ministers doing something else. And then the people with the money or lack of money are sitting having that. This needs to be everybody, and that's where you bring in, whether it be your World Bank, whether it be your development banks, but also the private sector. It's making sure the money's in the right place, and there are people whose pockets are very heavy at the moment, and what can we do to sort of share that to some of our most vulnerable? I think that governments need to take a whole systems approach. Really difficult when you're on a political cycle, really difficult when you are looking at, well, we've got a different government potentially coming in X amount of years. How do you get that long-term sustainability? For example, Malawi have done Malawi 2063. Now, in 2063, I'm hoping that I am somewhere drinking tea with my dogs or something along those lines. But what that shows is that vision that Malawi have now. It's in law. So whoever comes in subsequent governments will still have to uphold what is now being put into legislation about their vision for 2063. So this needs to be how governments have that whole systems approach, but not just for them and their political cycle, but for the future of their country and their population. And then the other thing I would be saying is also about, and I've come back to, this is about the people, this is about me and you, this is about our families. So let's help with that disconnect. Let's make sure that what's been going on at high-level events and the talk at G20 and the talk at G7 and G77 and COPs, 3 COPs this year. COP 16 we've got in Cali, we've had COP 29, and we've got COP 16, which is a desertification COP in Saudi at the beginning of next month. How do we actually put that into action? And that's where your people come into the conversation. And it's enabling our communities, our youth, women and children to come up with those innovative solutions and putting them into place.
That's what excites me actually over the next couple of years. Earlier this year I was in Helsinki. I was talking about how do we make that transition? How do you engage communities? How do you bring solutions? How can you springboard solutions all over the world? That's basically what we've been trying to do, using health as a means through the World Health Innovation Summit. So you have an innovation in Newcastle that can be springboarded to Delhi and vice versa, everyone, and using health as that apolitical, power, convening power to share that knowledge.
Which is what we're doing at the Commonwealth. Sorry, Gareth. Which is what we do at the Commonwealth. With exactly. That 56, of course, everything from India right down to Kiribati, and we all have an equal voice. So whether you're a G7 country, a G20 country, or you're a small island developing state, we come together and we share. I launched the Commonwealth Disaster Resilience Centre in Samoa in October October. For anybody that wants to go online, I'll put the link in the chat. And in there is a whole host of different climate and health solutions that people can go and say, well, actually, here's a menu. A, B, and D will work for me in my community. And here's the opportunity for funding. And it gives you a link to where people can get funding. Because again, some of these processes are very long and enduring. So copy and paste, steal with pride. We're all in this together.
Exactly. I've got two final questions for you, and we're doing well in time. What role do partnerships between governments, the private sector, and civil society play in addressing the intersection of climate and health? I mean, this is a critical aspect of what has gone on at COP, isn't it? It's really like, how do you mobilize that public-private finance? How do you blend capital?
Yeah, absolutely. So there's that start of more and more of the private sector being part and parcel of these conversations. But it can't just stop with conversations. It has to be action. It's a case of show me the money. Do you know, we absolutely need to make sure that we get money out to people. We have to trust people to do the right thing with the money, because they know what is needed for their communities, etc. So I think we need to continue collaborating with people that you've never spoken to before. Make yourself uncomfortable. Go and speak to someone that you've never spoken to before. Even people who are on different wavelengths to you. There's no point in speaking in an echo chamber, because you're just going to have the same conversation and agree with it. So as a health professional, I now speak to environment ministers, I speak to finance ministers, I speak to climate ministers. They all talk different languages. I talk health, but now I can speak finance and environment and biodiversity and climate conversations as well. So I would stress that we need to bring people together and just talk about humanity and talk about people.
Yeah, I mean, I totally agree with you. Putting yourself in that environment outside your own sort of sector is so enlightening, because I mean, I've just talked from experience, bridging into the financial sector, for example, over the last 2 years has been fascinating, because you learn so much. There's just so much to, dipping in and out of different sectors. And there is so much to learn from so many different sectors. And you're right, put yourself in that environment. It can be very fruitful. I just want to talk about finally, and I've got two short questions, final thoughts. How can we better educate and raise awareness about the links between climate change and health, especially among communities most at risk? So how do we get that message out?
And again, so look, there's different approaches to what's going on in the global north and in the global south. So, for example, when COP was happening at Glasgow, and you speak to people and you say, "Oh, do you know about COP?" And they're like, "Oh, is that a police person?" What does climate change and COP and high-level events mean to the normal person? How does it impact their day-to-day life? Well, it doesn't impact you unless you've had your house flooded, unless you've not had any food, unless you've seen and had that impact. How do we put ourselves in the shoes of people who are suffering from the climate change? I mean, even just some of the increased heat that we've been seeing in the UK over the last couple of summers, people aren't used to that, especially not in Scotland. And so, there is the lack of the infrastructure to support that. I think there's something around, how do we raise this conversation with people not on this agenda at all? How do we raise this? I mean, it's critical. It's a national security issue, climate change. How do we raise this to people who are completely removed from that? And so I would like to think about those people who perhaps have those global reach, that global audience, and engage with them. How do we reach people, for example, who are not thinking about what's going on in COP, but maybe more thinking about what's going on in some of our reality television shows as well. So there's a really good example about how we bring that into everybody's day-to-day life, and using media, whether it be television, whether it be Netflix, whether it be Instagram, whatever, and reach people. You know, we think about fast fashion and think about the world of fashion, and again, how much has been used in the climate space for that. Water, etc., and all the sort of supply chain side. So again, how do we engage with people in that conversation who want to buy the latest pair of whatever it is they're going to be wearing this month in December? So again, we can't just talk to the converted. We can't just talk to the people that are already on this page.
Yes, yeah, that's where we got it. And I think there's lessons there. You know, I mentioned in the last session, the lessons from COVID was we worked very successfully in the communities. Let's get ourselves back out into the community so that we can engage and learn. That's where we can learn and co-create the solutions. My final question to you is...
I'm just going to come back, sorry, Gareth, and then but how do you then have those conversations with people, for example, in some of our Commonwealth member states who are worrying on a day-to-day basis that they've not got food to feed their family because of food insecurity, because of the drought, because of the flooding that's taken away their crops that they were going to sell? So that's a really difficult conversation because I need to feed my family right now.
Yeah, and I
can't worry about tomorrow, you know. And
we are very privileged, you know, in terms of where we're at in the UK and around. You know, I do recognise that these are difficult questions, and we do have to start to move the dial. I totally agree with you. I mean, we know, for example, over 3 billion people don't have access to healthcare. 3 billion. You know, so we are very privileged in the UK, and I recognise that. And a lot of our, you know, people who will be tuning in will be coming from those disadvantaged areas. We do need to address those challenges. I mean, that's what we have to come together. It can only be done by collaboration, mobilising, working, breaking the silo. That's the whole system. And my final question to you, Alison, is, I mean, you know, we've had a fantastic discussion this morning. You know, the bridge between health and climate is so obvious, you know, and you pioneered it, you know, COP26, when you said you had the first health, that was the first drip, you know what I mean? Are you optimistic for the future? Do you think that we are now beginning to see, I mean, you know, there is a lot of geopolitical tension around the world, but perhaps health and well-being can be a force for good in this climate.
Absolutely. Climate change is about health. You know, health is everything. If you don't have your health, then you haven't got that's it. So am I positive? Do I have to have hope? You have to, you know, because we'll be doomed otherwise. So absolutely we need to. And the sort of the health community is now galvanized. There's lots more people aware of the importance of health and climate. There's lots more environment ministers aware of it now, that we're certainly in the Commonwealth, that I've been having conversations with about health being so important in this agenda. So I think what we do is we have hope, and we look and work with that future generation, tomorrow's leaders, tomorrow's people that are actually going to help us address the balance in this space, because we all need it.
Yeah, well, I think also and I mean, it came up in the last conversation as well. Like, we are making the change. We are dedicated. People are working hard. I just want to thank yourself, Alison, for joining us this morning. It's been a brilliant conversation. For those who've tuned in, listened, you know, we're very grateful for your support. And we do look forward to, as we've just talked about, working together to be able to bring those solutions to the forefront and breaking down those silos, working with different industry. Our next conversation starts in 15 minutes. It's around AMR and infectious disease. Do join us. Alison, I just want to thank you for taking part this morning, and for everyone who's joined us, we wish you a good Friday.
Thank you. Thank you for having me, Gareth. Thank you. Bye-bye.
Pleasure.